For tracking broken appointments, Open Dental actually recommends having correct setup to start seeing correct data for broken appointments and to track broken appointments. And the way you do that is by make sure you go to setup on top, then you go to appointments, appointment preferences. Then usually if you're not tracking anything, if it's not set up correctly, it will usually say under in the top section here, broken appointment procedure type, it will say none. So let me just show you what this means. So let's say you have this appointment. Right now, if you don't have it set up, what you may be doing is just right clicking, breaking appointment. You can see when you can just do that without it'll ask you and you can just break the appointment. Maybe it'll ask you for an adjustment. Maybe you can add a fee to procedure. And this is a com log node that you may enter. And that's pretty much it. But what this is doing is not actually tracking anything. And if you go back to their account section, you can see that there is no actual dental codes. It's just added as an adjustment. Okay. What you really want to do, there's two codes that are used to mark broken appointments. There's the D9986 and the D9987. So let me show you. So this is exactly what Open Dental actually recommends. So you want to make sure you go to setup, appointments, appointment preferences. Okay. Then you want to, instead of none, it should be both. Select both. And you can just make sure these two are checked off, make broken appointment comlog entry and make broken appointment adjustment. And you can just select, I've selected no show as the default, but you can change that at the time of. So click OK. So now that's set up. All right. So now when you right click, let's say you want to break this appointment. Now, when you right click, if you look now, if you hover over break an appointment, breaking an appointment, there's actually options. So if the patient actually missed the appointment, if they're no-show, you're going to want to select these three on top, one of the three on top. If the patient actually canceled the appointment, let's say they're canceling less than 24 hours or less than 48-hour notice, then you're going to want to select one of these. Okay, so let me show you what it does. Let's just say we're going to leave it on the appointment book. Let's say patient is a no-show. We're going to mark it as appointment missed. We're going to leave it on the appointment book. I'm going to select that option. Here is the comlog. All right, now if you go back to account, you can see there's actually a code that's added, D9986, okay? This is what Open Dental actually recommends, all right? For Teamio to work correctly, this has to be set up.